Hello everyone, today we will be drawing a diagram of the carpal tunnel of the right hand seen from a proximal view. But first, go to the bathroom, go pet your dog, eat, sleep, mow the lawn, talk to a friend, watch all your stories, scroll through useless pictures, fight on social media, Netflix and chill, watch the game, grab a coffee, and tell your mom you love her.
A few moments later, a few inches later, 2 hours later, 1 eternity later.
Now that you're back with a fresh mind and have nothing to distract you, let's learn all about the carpal tunnel. Now grab a piece of paper and a pencil and also some colored pencils. We'll start by drawing a semicircle shaped figure. Next, we'll label this as medial and over here as lateral. We'll focus on the structures forming in the carpal tunnel first, which is the 8 carpal bones and the flexor retinaculum. However, in this drawing, we'll only draw the 4 carpal bones. The first bone we'll draw is the hamate. Next one is the capitate. Lateral to this, we have the trapezoid. And the last one we'll draw is the trapezium. Next, let's draw in the flexor retinaculum, which is the roof of the carpal tunnel. It is important to know the flexor retinaculum bifurcates here as an extra limb going down attaching to the trapezium. Please note that the medial wall, lateral wall, and the floor is made up of the carpal bones, represented here in black, and then the roof is made up of the flexor retinaculum, represented in blue. In some drawings, this concept is used, which the carpal bones only form the floor. The medial wall, lateral wall, and the roof is made up of the flexor retinaculum. This one is wrong. This diagram is also wrong because there are gaps in between the carpal bones. Even though there aren't any connections, they are still located side by side. Be familiar with these. Now, let's label the structures forming the carpal tunnel. First one is hamate, H for hamate, C for capitate, TD for trapezoid, TM for trapezium. Next is the roof of the carpal tunnel, which is called the flexor retinaculum. Now that we've done the structures forming the carpal tunnel, let's move on to the structures found inside the carpal tunnel. The first structure is here in yellow, the median nerve. The next one is a muscle, flexor carpi radialis, along with the synovial sheath. Next one is flexor pollicis longus, again with this synovial sheath. Next is a little tricky. We'll be drawing 8 tendons which will represent 2 muscles divided into 2 levels. First one is a superficial level, and we have, and immediately beneath it we have another 4 tendons. Now we'll be drawing the synovial sheath of these 8 tendons. So just draw it like this. The synovial sheath has an E shape. If you can see here, the middle limb of the E shape only covers until the 2nd tendon. The upper and lower limb of the sheath covers till the 4th tendon. On to the labeling. We have these 4 tendons as flexor digitorum profundus, and these 4 tendons above it are flexor digitorum superficialis. Great job! These are the structures forming the carpal tunnel and structures inside the carpal tunnel itself. One of the main significance of the carpal tunnel drawing is the carpal tunnel syndrome, which is the compression of the median nerve. Some of the ways carpal tunnel syndrome can come about is overuse, thickening of the synovial sheath and tendon, nerve damage, and many more. The clinical manifestation of the carpal tunnel syndrome is paresthesia, In the layman term, it is referred to as limbs falling asleep and feelings of pins and needles. There you have it, the complete drawing of the carpal tunnel. But wait, there's more. Just for completeness, from the hamate bone, we have a collection of muscles called the hypothenar muscles. And just above the trapezium, we have a similar structure called the thenar muscles. Next, we have the ulnar nerve. Just lateral to it, we have the ulnar artery. And next to this, we can add the palmar cutaneous branch of the ulnar nerve. In the middle, we'll draw a structure of a muscle. This is the palmaris longus muscle. And the last one is a small nerve from the median nerve, called the palmar cutaneous branch of the median nerve. And that's it. Quickly, draw the set, then the stars of the show, and finally the supporting cast. Thank you for watching, and please join us next time when we rev it up for more anatomy.